I'm Amy Greminger and I'm with the medical school. And today I get to talk to Keely Flavin. Keely, can you introduce yourself and your role?
Hi, yes, my name is Keely Flavin. I am a dental hygiene faculty within the Division of Dental Hygiene. So I work part-time clinically still at an office downtown, and then I work another 3 days a week here at the School of Dental Hygiene, teaching in clinic and in didactic courses.
Fantastic. So, for those of us who are less aware, can you tell us a little bit about what you do in your profession on a day to day basis?
Yeah, so I have a really unique experience and opportunity within my role as a dental hygienist. So I work clinically at my downtown private practice with just one dentist there and another hygienist. And then I have the really a cool opportunity to round at the University of Minnesota Fairview Hospital. And so this is a part of my teaching appointment, and I'm able to do rounds with the medical team as well as consult to patients that they're asking us to come look at and triage and develop oral care plans for. So that's part of my teaching appointment at the U of M. And then when I'm teaching dental hygiene students, we also have the opportunity to collaborate with other providers on the floor, such as dentists and occasionally pharmacists when they're on the floor as well.
That sounds super interesting, especially the idea of seeing people in the hospital, which I'm not as familiar with. Can you tell me a little bit about what kinds of interprofessional work that you engage with?
Yeah, so the hospital rounding is a really unique experience. So we, as my colleague Cindy Stahl, developed a dental hygiene consult service. And so what this service is we have members from the medical team, so doctors from general medicine, from hematology and oncology, from emergency medicine, as well as it makes up the team of pharmacists, and occasionally there's oral surgery residents as well. But so a medical team member will page us to consult in a patient's room if they're having a problem with their mouth or if they're just really sick and they don't know where it's coming from. They want, the experience from the oral health provider to see if there's anything that might be contributing to this patient's condition. So we're able to go see this patient, do an oral hygiene assessment, triage, develop oral care plans for while they're in the hospital to reduce their risk of developing any other conditions while they're in the hospital. And then we report back to the medical team and kind of collaborate on the next step. So, do they need some imaging? Do they need further examination from the dentist from the GPR clinic? And what can we do for them while they're in the hospital to stay healthy?
I'm excited just listening to you talk about that. That sounds so interesting and really helpful for patients. Um, beyond this particular experience, are there other regular interprofessional collaborations that people in your profession engage with?
Sure. So, I mean, in your regular general practice, your private practice dental office, dental hygienists and members of the dental team really have to be able to communicate with members of the medical team in order to properly provide and safely provide for their patients. So, if you have a patient with a medical condition, certain medications, or recent surgeries, we will be in contact with their doctor or with their surgeon to make sure that providing dental care is safe. So we really need to be confident to be able to communicate to the patient's medical team as well. So there is some communication that happens in interprofessional teams within just kind of the private practice general dentistry setting. But I think what we're going to see more of these interprofessional teams, going to mobile dental clinics. We might be collaborating with, if the mobile dental clinic is at like an assisted living, or if they're at some sort of like a healthcare home, collaborating with providers from outside of dentistry as well to care for these patients.
Well, that sounds like you have a lot of experience working on interprofessional teams, which is fantastic. One question I have for you is so these are students that are early in their careers. What kinds of skills are really needed for successful interprofessional collaborations? What kinds of things should they be focusing on learning?
Well, I think, just having an open mind to what everyone brings to the team. So you can think of yourself as the oral health expert, but remember that you do fit into to other roles in the interprofessional team as a whole. So we want to focus on patient-centered care. We want to focus on, kind of holistic care, and that means incorporating everyone from every team to provide the best quality of care. So I think just kind of keeping an open mind and remembering that, the mouth is attached to the rest of the body, and it's really important to get kind of opinions and expertise from other providers. And I know that, at the University of Minnesota, they really advocate for interprofessional teams, and they provide a lot of opportunities for us as students to be involved in those teams. And so I think just trying to absorb as much as you can while you're on those different rotations, and opening your eyes to maybe something that you didn't initially picture yourself practicing as. I didn't think that I would ever end up working in a hospital as a dental hygienist. I always pictured, clinical care for the rest of my career, but having that opportunity kind of opened my eyes to the possibilities and kind of where we can take our careers in the future.
So you kind of spoke to this a little bit of just kind of being open to the different connections, but how are there other specific skills that you worked on to try to become more proficient at interprofessional collaboration, like communication, or are there any, how did you learn to function effectively in this space?
Yeah, I think communication's a big thing. Being able to, just have that effective communications with members of team members who are not of your own profession, and having confidence while doing that as well, I think is a big thing. It can be kind of intimidating to talk and reach out to someone from a profession that you're not, you didn't study it for 4+ years, so you're not maybe the most familiar with it. But having that confidence that, you do have a role in the interprofessional team, and that you do belong there. And so having that confidence when you're communicating with other people from interprofessional teams, as well as just having that respect and communication as well, kind of having that teamwork mentality in mind. And then, also just kind of in my spare time, I thought it was fun to kind of research, the medical side of things. I learned all the dental stuff, but now when I'm talking to this doctor about, can this patient be treated today with having a surgery recently, I want to know kind of why. So I kind of brush up on that research then, and brush up on those terminologies, so I can effectively communicate to the doctor then about what I really want to know.
Well, fantastic. It's been so interesting talking to you. Thank you so much for your time. I really
Yeah, thank
appreciate
you.
it.
No problem. Thanks.